Thank you, Amanda. Clinical trials are underway on vaccines for children now. Both Pfizer and Moderna are doing trials in children who are 12 and older. Experts believe those vaccines could be authorized for children in that age group by summertime. Doctors say they have to test whether or not the vaccines are safe and effective in kids like they were in adults. They say vaccines for kids 12 and under could be available by the end of this year or early next year.
Now 9:34. This story is new here for you this morning. The makers of COVID-19 vaccines are trying to figure out how to tweak their recipes against worrisome virus mutations, and regulators are looking to flu as a blueprint if and when the shots do end up needing an update. Fox Medical Team's Dr. Mike joins us now live with more on all of this. Dr. Mike, it is always good to see you. How are you this morning?
I'm fine, Danielle. I'm better now that I'm talking with you. I know Amy's around there somewhere. How are you guys doing? We're
doing good, but we're in separate studios because, of course, we're trying to remain socially distant as all of this is going on. And, what I find so fascinating is that when you've got these variants, Dr. Mike, and I'm using my parents as an example, my mom and dad just got their second COVID vaccine shot yesterday, right? And now we've got these new variants out there that we have to be concerned about. What's the research and what happens if they do need an additional shot?
Well, Danielle, I congratulate your folks on getting their shots, and they are in a much better place now that they have been immunized. Remember that so far, the vaccines that are available seem to work rather well with some of these variants. Time will tell what we need to do in the future. I think we will know that there's an issue when people like your folks who have been fully vaccinated end up getting sick and in the hospital, God forbid. So if that happens, then we know that we need to get a booster going. And the manufacturers are already working on that to modify. And by the way, the messenger RNA vaccines can be tweaked, if you will, fairly easily. And that's what all the manufacturers are doing right now, because in my humble professional opinion, we are going to need boosters. I don't know when, but it may be something like every year, like a flu shot.
Dr. Mick, the other thing I find fascinating is that, this seems to just change and evolve because, obviously we started from the beginning where we didn't know a whole lot about this virus, right? And we're learning kind of as we go along. And one of the interesting studies that came out was about brushing your teeth, right? That perhaps brushing your teeth and flossing your teeth could help in the fight against coronavirus. How so?
I want to sink our teeth into this story, okay? I brought my teeth with me, and the bottom line is if you have gum disease, terrible, terrible, not only is it bad for heart disease and everything else, but it can also increase your risk of being hospitalized and even dying from COVID-19. It has to do with inflammation. So a lot of people have been putting off dental care. I'm one of them. I've got to get in. If you can, go see your dentist, because bad teeth equals bad health. You want to get in and get taken care of, because this study just reaffirms the fact that if you have bad gum disease, bad teeth, you're putting your health at risk.
And so for people who may be fearful of going to the dentist because of coronavirus, it's worth it to go. Obviously, everybody's masked up and taking safety precautions. So that is actually some great advice there, Dr. Mike. And you always bring good advice. That's why we love you. See, I said it first. I said it first this time, Dr. Mike. I said it first. I beat you to the punch.
Well, it goes both ways. Love is a two-way street.
You know what? And you are right.
Yeah. And I'll tell you what, the song, What the World Needs Now is love. And I love you. Danielle, you're the best. You're a wonderful human being, and I'm honored to interact with you, even if it's just a couple times a month. I feel very blessed.
The feeling is mutual. Dr. Mike, thank you so much. I'll see you soon.
See you. Love you.
Amy, oh my gosh, she is
so much
just
love.
The best.